Auzubillahi minash-shaytanir-rajeem. Bismillahir-rahmanir-rahim. Uh, Dear friends and audience, as you know that I myself, Dr. Shazad Wasim, have been interviewing since the time of the corona about corona diseases and on other health problems, and we had interaction with many great uh, professors and specialists of their team. And today I'm very privileged and feeling very honored that I am live with a senior consultant gynecologist right from the London, and he has joined us. Thank you. We welcome you, Dr. Munnawar Hussain, for joining us and giving your precious time. Welcome.
Thank you so much for inviting Shazad. It's my privilege to speak to you all. Thank you so much.
Thanks. Likewise. So, as most of us know, that your specialty is gynecology and obstetrics, and then you went for further uh, specialization and you uh, studied uh, infertility. My first question is that uh, do you feel, as you live in London, uh, do you feel that there is some sort of reluctance is uh, uh, present when some female comes to a male gynecologist in London? And if, and what about if you have some experience in Pakistan? Is there any factor of gender discrimination?
Thank you. I think it's an important question, Shazad. Being a male gynecologist, people may have some reluctance. Probably it's based on the culture. It's not based on religion or anything. In this country, you will rarely find a female who wish to have a female gynecologist, which is acceptable. But majority of the patients would not have any objection of seeing to a male gynecologist. I have worked in Pakistan. I did my fellowship. And I think this was a major issue which I faced being a young male gynecologist. And when I wanted to do fertility specialization, I did not have an opportunity to get any training in any unit. And hence, I had to come abroad to do this. Regarding fertility treatment, in this country, I don't think there is any reluctance to see a specialist for fertility treatment, but
Okay,
there
that's
are
great.
there are so many people
Thank you.
who probably
Yeah, I
do not.
got your point. Obviously, there is a huge cultural difference between Pakistan and England. So this is understandable. The reluctance is understandable. So, and I have, before your interview, I got many messages when people came to know that you are coming online. Uh, so, on the behalf of my messages, I am asking the questions.
Yeah.
Uh, uh, One very common question which the people are asking is that people say that we have gone through all the medical examination, both male partner and the female partner, and their reports and everything comes to be right.
Yep.
Okay, and even then, if they don't go for any surgical procedure or any intervention, naturally they are not, the female, the couple is not able to conceive, to have a baby.
Mm.
Please
Yeah.
enlighten us that uh, is it possible that both partners are fine and even then the it is not conceivable?
Yeah. So, I mean, I'll just start from the basics. Shazad. Infertility is when somebody has tried to have a baby for 1 year and they're not able to conceive. And that's the time when you start investigating. Uh, the investigation starts from the male partner. You do semen analysis. From female partner, you do her hormones to check her egg reserve, and then check whether her ovaries are releasing an egg or not. Do an ultrasound scan to see the pelvic organs are normal. In 15 to 20% of the cases, even if you do investigations, you may not find anything. And that's called as unexplained infertility. Uh,
Oh,
15 to 20% people may not have any cause and still may not be able to conceive. Uh, Having said that, these couples are probably more frustrated because if there is a cause, that can be treated. When
yeah,
you don't find any cause and even then you are not getting pregnant, that's more frustrating. And
yeah.
again, it depends the level and the center where they got investigated and what was the standard of the lab where the male had semen analysis and female had her hormones. But even if you do it in the best lab, you will find couples who are not conceive, and that's called as unexplained infertility.
I'm
There are
sorry. I'm sorry, Dr. Munawar.
yeah,
I'm interrupting you because a question is popping up in my mind. As you started from the basics, then you said that our first step is the analysis of the male
yeah,
uh, uh, partner. But
yeah,
in Pakistan and in most of the countries, when there is an issue of pregnancy, most of the time the females are uh, said to be the said to be
cause,
having the problem.
yeah.
So why don't uh, is it stigma uh, or why should we go to check the males first and female then why not we go for the females to check up to go for the checkup first? You know this phenomena prevails perhaps. I don't know about the western countries, but in subcontinent usually the ladies are thought to be the cause of the issue.
Now, when you start investigating, male partner should do semen analysis first. That's the first investigation. Now, I can understand from Pakistan's cultural point of view, male probably think uh, is the female cause, but in reality, 50% causes of infertility are male related and 50% are female. So it's half and half. It's not that female is the only problem. Number of times investigation you find there is problem with the sperm analysis. So I normally suggest to do semen analysis first. In this country, when you go and see a GP, uh, they will do a semen analysis first. Then they will do female hormone levels scans, the basic investigation. Then they refer them to the clinic. Pakistan is
Okay.
obviously culturally different. We need to probably increase the awareness among general population. I don't know how much time it will take, but the male should come up that I also would like to investigate myself first, rather than just blaming a female. And this is the reason number of people they get divorced because they think it's the female.
Yes.
And when she gets married, she
That's a
have
great. Yes.
pregnant with the next
That's a
man.
great
So it's
thing I just said that there is an utmost need of awareness in the society, and I hope in future we can take you online again also, and
yeah,
we will at our what everyone can do at his own level. We can
yeah,
try to bring this matter into public awareness as far as we can do at our small forum. And maybe some other one picks up and the message spreads to different forums again. And I hope and I want you to please promise me online that from your busy schedule, you will definitely give me some time uh, for any such issues which the Pakistani people are facing, or people anywhere in the world, or humanity is facing. In short,
And I'll be really pleased if I can contribute a bit to
thanks.
increase the awareness among the general population, because I think uh, around 10% people they suffer with infertility, and people may not think this is a disease, but actually it's a disease according to WHO definition of diseases. Infertility is a disease. So I will definitely like to contribute wherever you think is important for my involvement. Thank you.
And thank you. And another question regarding to your subspecialty. Uh, what is the treatment of infertility, whether it is male or female?
Now,
Kindly explain a little bit. What do
yeah,
you do? What are the uh, possibilities? What are the routes? What are the ways by which some couple can have a baby from Islamic point of view?
yeah. Now, when you investigate, so you're trying to see where is the problem. Is it the female partner or is it the male partner? I will talk about female partner first. And I know in Pakistan, PCOS is very common problem for irregular periods, and we know PCOS is
Polycystic ovaries.
sorry,
Polycystic ovaries, you mean?
polycystic ovarian syndrome is a
Ah,
commonest cause of irregular periods and infertility. Because if somebody has irregular periods, it's highly likely that the female is not ovulating. So that's the commonest
okay.
cause from a female point of view. Then comes the tubal problems. Uh, Probably in this area where I live, there are more infections like chlamydia, gonorrhea, and that causes tubal damage. In Pakistan, it may not be that common, but yes, tubal cause is another cause of infertility.
Oh,
Talking about male partner, in semen analysis, there are three main important things which we check. What is the sperm count? And according to WHO, there should be more than 15 million sperms in 1 ml of a semen. Yes. Uh,
okay.
30% and above should be motile, and 3 to 4% should have normal shape, is called as morphology. So there should be normal count, normal motility, and normal morphology of the sperms. If we find there is any problem with the count, for example, if somebody has very low sperm count, the chances of conceiving naturally are quite low because the sperm count is very low. Even if you give female ovulation induction, like if somebody goes to GP and they give her Clomid, uh, the pregnancy won't happen because the sperms are not there. A male who has got severe oligospermia or azoospermia when there are no sperms will need IVF treatment. And if a male partner has low motility of the sperms or low morphology, yes, you can try some supplements which can help to improve the sperm parameters, and that can help to conceive. But invariably, Shazad, uh, when we have investigated and there is male partner involvement, invariably the couple will probably need assisted conception. It's more easier to manage the female partner if she's not ovulating or tubal blockage. We can try and reopen the tube by
Yeah.
surgery, or we can give her medicine for ovulation. But if there is a significant male partner involvement, then you go for IVF treatment, which is called as test tube baby. And that again depends what is the sperm count. If the man don't have any sperms in the semen, we may
Means
try
as
extracting
means
some sperms.
he's since birth he's unfortunately suffering from azoospermia.
Yeah. Now, some people they do have some problem. For example, if somebody had radiations or chemotherapy or had some
Oh,
injuries to the testes,
hmm.
that can cause damage. If somebody had uh, hernia repair, you don't know if there's an expert surgeon who has blocked both was deferens on both sides, and that can cause
Okay.
azoospermia as well. That means,
What?
uh, so the cause of azoospermia may be obstructive or it may
Okay.
be non-obstructive. Non-obstructive is when the sperms are being produced. Obstructive is when the sperms are being produced, but they are not transported to the normal site. While
Yeah, they are
non-obstructive
blocked.
is when the testes are not working properly. In both cases, you can try a surgical sperm recovery. We can try and extract some sperms from the seminiferous tubules, and then you culture them a bit further, and they get mature, and then you do ICSI treatment. You inject one sperm into one egg. But that's all different treatment, which is involved in IVF treatment.
So I would like to talk about, as we are close to ending of our program, to talk about IVF.
Yeah. So IVF, in simple terms, is in vitro fertilization or test tube baby. Test tube baby doesn't mean that baby will be formed in a test tube. It's basically a name given to the technique. What we do in IVF, we give hormones from outside to stimulate the egg production in the female ovary, and it takes on average 2 weeks before the ovaries develop sufficient number of eggs in the ovary. Probably I would like to have 10 to 12 eggs in a cycle. Once uh, we are happy that the ovaries are responding well, that the patient goes to operation theater and we extract eggs from our ovaries through the uh, transvaginal ultrasound scan. There is a very small needle attached, and that aspirates all the eggs. Those eggs goes to the lab, and on the same day, the male partner gave his semen analysis, semen sample. It's very important in Pakistan to understand that the IVF or test tube baby is made from the male partner's sperms. It's not
Yeah,
made
not from
from.
other partner or from the other laboratory. Yes,
Yes, absolutely. So it's
you're
all
not
Islam.
the freezed one. Yes,
Yeah, it's all Islamic. There is nothing
yes,
non-Islamic involved in IVF treatment. I think there's a misconception among the
yes.
people.
With your permission, I would like to clarify this very important point. When you take sperms artificially, and Allah the Almighty has given you this opportunity, and He has given you the ability from His abilities to go and research, and with His will, uh, we have reached at this point. So what we can do, we will be using the sperms of the husband of the
Yes,
same wife, not from any other male, or as they are available in freeze forms, that will be non-Islamic. But
yeah,
we will take in same man, that is purely Islamic, and I don't feel there is some problem in it.
yeah.
So I want to clarify this.
So just
Please carry
to
on.
make people aware, IVF is all Islamic. There is nothing non-Islamic. Uh, if it is done properly in a proper center, and the doctor
Yeah.
understands this is very important for the couple that they don't want to use. While the world I'm working in, you can have egg donation, you can have sperm donation. That's all different, which is obviously
Yes,
not
that is
Islam.
not acceptable in Islam. Okay.
Yeah. So then you take his sperms and the female eggs, and they either inject one sperm into each egg. So, for example, if there were 12 eggs, they will select the 12 best sperms under the microscope, and then they will inject one sperm into each egg to fertilize it. And then they culture those eggs in the culture media in the lab and let the embryos develop. So, embryo is transferred back into the female uterus either after day 3 of fertilization or day 5 of fertilization. So you make embryos, develop them in the lab, and then you transfer back into the uterine cavity. And then obviously you leave it to Allah. You give hormones to female so that the lining of the womb keep intact and the embryo keep on developing the uterus. Then you do pregnancy test, and the pregnancy develops like a normal pregnancy in the uterus. So this is in very, very simple and brief term that what is IVF ICSI. There is another more or less invasive procedure called as intrauterine insemination, where you give probably clomiphene citrate for the female to develop an egg, and then you give a trigger shot for the ovulation to happen, and then you inject the sperms through the female cervix, prepared semen sample through this female cervix, and those sperms they go to the fallopian tubes and fertilize the eggs themselves. So that's less
Okay.
invasive as compared to IVF ICSI treatment, which is more advanced, and that's all done in the lab. I hope it made it easy for everybody to understand.
Yes, thank you. And I would like to share you my experience being an ophthalmologist. Uh, when there was a couple of years back, when intraocular lens was invented uh, earlier in the early days, uh, people in Pakistan used to deny no, that they say, okay, take out our cataracts, we will wear the glasses of plus 10 number, but we will not go in the grave with this artificial lens.
Okay.
Then, with the passage of time, realization and awareness develops now. If we perform cataract surgery and if we do not implant intraocular lens, it is almost for an ophthalmologist, if he intentionally not putting the intraocular lens, it is almost a crime now,
Mhm.
because the patient will be just 6 by 60 and he will wear plus 10 number glasses, and his vision quality will still not be that good. So I think with the passage of time, the acceptance and awareness arises, bubbles, and a time comes when whole of the society accepts it.
Absolutely. I mean, you live in Islamabad. There are
Yeah,
IVF units in India in Islamabad. There
yeah.
are units in
Yes,
local.
people are doing here. Yes, yes. I'm talking about the general population and general concept, not for the elite class. I'm talking for the masses of the Pakistan.
Yeah, yeah. And obviously, it's an expensive treatment. Although it's not that expensive in Pakistan, but still quite expensive. And affordability is another issue. That how many people can
Yeah.
afford IVF?
Here,
Uh,
I would like to I want to second your point that like cataract surgery, it is very costly in England,
yeah,
and many of my patients come from England, come from Dubai,
yeah,
just for LASIK to get rid of the glasses for cataract surgery, because LASIK costs there almost 15 16 lakh
yeah,
in London,
yeah, yeah,
and in Pakistan it costs them not more than, I don't want to say any a fixed amount, but you cannot imagine, it's very cheap. Pakistan is very cheap as far as medical treatment is concerned. And the second thing which I would like to add is that Pakistani medical education and Pakistani doctors who are practicing in any specialty, they are doing very well. They are not in any way, you can say, they are second to none. If
So
some eye surgeon or gynecologist is doing IVF or LASIK surgery, the results are very much comparable.
yeah, yeah. No,
But
Pakistan.
because of the our as a country, because of our political history and our financial issues, being a third world country since our birth in 1947, uh, where we stand now, we have not been given that attention which I think, which the Pakistani nation deserves.
Yeah. Well, I mean, gradually, inshallah, with the passage of time, once the economy gets better, uh, things will get
Inshallah.
improved. But the medical treatment is very expensive here. Although NHS, the National Health Service, contribute a lot for providing the services, but there are still procedures which, for example, IVF is not funded by NHS in all areas. There are some areas which fund one cycle or two cycles. There are few areas where NHS doesn't fund any. And again, uh, people may not be able to afford because it's quite expensive. Uh, Pakistan may be another destination for medical tourism in future once the conditions are better. We can develop services for other countries to send their patients for the
Yes.
treatment because we have all the
You
experts who can provide services, who are trained in the other countries, or even people did FCPS like yourself. It's a very, very highly competitive area where you are trained. And I graduated from Pakistan. I trained in Pakistan. Unfortunately, I had to come out because I wanted to do IVF. I wanted to be IVF specialist, which was not possible in Pakistan. But I'm really proud. I'm graduate from Pakistan Qadis Medical College, Pahalpur.
and we
I
are we are proud of you, uh, Munnawar, uh, that our one of our Pakistani uh, doctor fellow is at a post of senior consultant in fertility specialist at a place where the people dream of going to, and we are proud of you. You are the pride of our nation, and
thank
people like you are the ones due to which Pakistan is one way in the one way is known for.
Now, Pakistani doctors are very well trained
Yes,
everywhere. Where you go to America, you go to England and other countries, Pakistani doctors are very well trained and they are very capable.
I think you you did FCPS also. As you said, I also did FCPS uh, by the grace of Allah. And you know that how hard FCPS is to pass.
It's a very difficult exam because the training is very difficult. You need
And
to spend 4 5 years training. You have to read so much. You have to
and
do.
the training you do for 4 years, and after that the part 2 examination is so tough, and examiners come from abroad, and that I think that is the basic reason I feel when they go out they have so much good basic knowledge that in the any other country just a little grooming brings them in a good shape.
Yeah. So, I mean, I did FCPS. I got my MRCOG examination part one exemption based on my FCPS. So that was
Yes,
based on FCPS. And I think at the moment, probably that equivalence has finished. But it was previously, if you do FCPS, your part one MRCOG will be exempted. And then you have to do only part two. So I
yeah.
did my part two only. And I got my PLAB exempted based on my FCPS as well.
Yes,
The
it is still in many countries there are many councils. Players becomes exempted. Part one and part two becomes exempted, and for example, for I, you may go for part two or part three, and part one becomes exempted. Plab becomes exempted in some countries, and in some countries, they simply take your examination or interview and may give you the license to practice. But I'm not sure about this. But I just want to say that FCPS has got a standing. Whatever you say, it does have a standing.
no, no, the standards are very high. Uh,
Yeah.
Training is very hard, and the level is very good, and that's the reason the overseas examiners, when they come to Pakistan for examination, they speak very highly about the training. So there's no doubt about it.
Thank you, Dr. Munawar. In the last couple of minutes, I would uh, 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 um, one I have received one message. Um, uh, I don't know how to phrase it for you, but I would try my level best. The question is that he said that I had a baby immediately after my marriage, maybe in the first 2 years, right?
Yep,
Then that was a girl, and he wanted a male child. As you know,
yep,
the culture of Pakistan, uh, we all want that we should have boys. So for the next 10 years, her wife could not conceive.
Mm-hmm.
Then he was not aware of that, or whatever. He was because of the
Sorry.
pressure of the society and some other reasons,
No,
he
sorry. My battery is finished.
married another woman.
Yeah, sorry. Yes, continue, please.
Yeah, he married to another woman after 10 years. And after 10 years, uh, when he married, the next year, he had a baby child from
Yep.
that second wife. Okay?
Yep.
Now listen, he got a baby child from the second wife.
Yep.
But what happened? At the same time, uh, he also had a baby child from his first wife after 10 years. So I want to ask what happened in this 10 years of period, and what happened that after marriage her first mother also first wife also conceived. Is some hormonal stimulation, something like that?
We don't know exactly, honestly, because it could be unexplained. Because
And
he had first baby very quickly and easily, and
hmm.
then he wanted to have a boy. They
No,
continued.
he has four boys from that wife, but one or two boys from the first wife also after he got married.
Yeah,
It is
I mean,
unexplainable.
probably unexplained. We don't know. We keep on hearing these stories that somebody
Isn't
had.
it possible? I don't have I zero knowledge of gynecology, but if I am imagining, is it possible? Just tell me, am I wrong, or is my uh, proposition or hypothesis, whatever you call it, is correct? That after he got married with the second woman, uh, his testosterone level became higher.
Yep.
His weak sperms became strong, and the woman, um, the second wife, after her conception, maybe some psychological changes came in that man, or in uh, his man's first wife, and that might be contributed towards this birth from the first wife. I don't know.
No. So it's
What do
very
you say?
difficult to explain why they did not get pregnant for 10 years. Yes.
Hmm.
And when he got married to another woman and had a baby boy, probably he psychologically got more relaxed, and then
Maybe.
Allah gave them a boy from the first wife as well. It's difficult. I don't see any medical problem. Probably it was unexplained. Maybe a
Okay,
element,
I want
an
to ask.
element
You
of
said
stress. Huh?
probably he was relaxed, so
Yeah.
it means that if there is an element of stress.
Oh, yeah. Stress does affect your chances to conceive, and when you
Yes.
don't get
I
pregnant.
would like to finish your talk on this topic. How stress is all. I think we are living in a uh, I our one of our teachers. May Allah give him a long life. He is an Islamic scholar, and he said that there was a cave life, there was a ice life, there was a many times. He said, now we are living in many eras. Now we are living in an era of anxieties,
Hmm. Yeah.
and we are living an era of anxiety and fears, and era of depressions. So how much this mental health uh, is responsible for this infertility?
No, the human race, Shazad, human race fertility is on decline.
Oh,
If you compare the sperm parameters of men in Pakistan 20 years ago with now, you'll find the sperm parameters have gone down. It's all over the world. It's not only Pakistan.
What is the reason? It's a
Now,
very
it
re-
is. It's probably combination of various things. Probably the food we eat. That's very important. How pure it is. What is the pollution in the environment? The water we drink. The society we live, which is full of stress. Uh, it's all affecting human reproduction. On another hand, female reproductive life is very short. Is not that like if you compare it with other species. Now, how do we improve it? It's There is no as such medical treatment, but uh, probably relaxing yourself by improving your lifestyle, uh, doing some activity, for example, exercise, walk, some other hobbies to keep self relaxed. But how can you apply these things to a man who is struggling to buy, to earn money to just run his kitchen? It's very difficult.
yeah.
Uh,
And though I am a doctor, it is a very it's a I am a very illiterate. I am feeling that the fact you told that the level of uh, sperms is declining with the passage of time
it
and
is.
in all over the world,
Yeah.
and as it is happening globally, so I don't think it is controllable. uh, I don't think it is happening by by some causes which we just talked about, which we identify, and maybe some many other causes which we have not yet been able to identify the causes. So multiple factors, known and unknown. So it is, but it is the uh, design of the nature.
Yeah.
It had to be happen like this, so it is happening.
Yeah. So it's all nature. Uh,
Yeah,
but our environment, our lifestyle is very important. Uh, the food we eat, it's all not pure as it used to be previously. The environment is so toxic. The pollution is so
yeah,
much. You probably see in Pakistan that smoke.
yeah,
Uh, that's a serious threat, honestly, for general health. I'm not talking about
yeah.
fertility, but general health is a serious threat for the people.
I visit Lahore, and I there is a huge difference between Islamabad and Lahore. It is difficult for me even to breathe because I am an atopic person. I become uh, I develop skin rashes, and I become asthmatic when I go in smoke.
Mm-hmm. Yeah, so there's multiple factors affecting human reproduction. Human fertility actually is on decline. Uh,
Yeah,
but
that's
issue,
great
that's not
statement.
issue in Pakistan, I believe, because Pakistani population is still very high. But there are people who are suffering in Pakistan who are not able to have a child, and their marriages just get destroyed. And there is a serious need of education, probably from the schools, to educate both girls and boys about fertility. uh, and number second, going to doctor is difficult in Pakistan. People probably try going to uh, non-medical people first, and
Yeah,
then when everything is just at the last stage, probably then they go to a doctor. So
yeah.
there's a need for educating the people. That's very, very important, from
Thank
schools.
you very much. And Dr. Razatur, thank you very much for your comment. Dr. Razatur lives in Paris, and he is practicing medicine there. And he has just sent some uh, like and love for both of us, and God
Thank you.
bless him also.
Thank
And uh, uh, Munawar, I am very thankful. It
you.
was
It's
a
my
very knowledgeable, at least for me. I will share it with your permission on my social media, and I will share it with you also the recorded version. If you feel it is appropriate, you may share it at your social media circle. And I am feeling very enlightened after this very fruitful and knowledgeable discussion from the man sitting besides me online right now. Thank you very much for being with me.
It was my pleasure. Thank you so much for inviting, and I appreciate your efforts of educating the people. I hope that will help, whatever way, maybe a little way, if somebody can get benefit. Thank you so much for doing this, and thank you so much for inviting me.
Thank you. So here we come to the end of our series of interview, and I thank you, Dr. Munnawar Hussain, senior consultant and fertility specialist, uh, Pakistani but settled in the London, and it is a pride for us. And for now, I ask your permission to leave. I am signing off and hope to see you in our next interview on the same channel. Thank you very much.
Thank you. Thank you.